Now you gotta start all over again.
Nada Hanance, where are you? You gotta do your intro all over again.
Everything set from here onward counts.
We're good.
Okay, take it away.
I don't sort of have a prompter, so I'll just.
Yeah, absolutely.
Great. Well, my name's John Gardner. Really, it's great to be here this morning. I think that this topic, travel, is something that, of course, it generates excitement when you think about traveling, and I think that if it's true that probably I'm guessing that in this room, travel inevitably involves questions, concerns about health. But in reality, if we think about it, global pandemic that hit us 2 years back suddenly made that applicable to just about anybody. And so really health and travel have probably become more intermingled than ever before as a result of this. And so what we're going to be seeing this morning is a combination of probably some tips and ideas that are particularly applicable to this room, but also applicable really to travel under any circumstances. So if you could go ahead to the next slide. We're going to be talking about basically these four topics: travel medicine, travel assistance, medicine specifically focused on health concerns, assistance more generally, what kind of help when we're traveling, certain tools, and then specifically travel insurance coverage. Of course, as Kyle has now, so we'll be looking at some of the things that we've been on. In general. Go back 1 second. Yeah. So about us, Ingle started in 1946. Ingle is a well-known name in the travel insurance industry in Canada. Essentially, was one of the forces in starting the travel insurance industry in Canada. Basically, so the name has been around for more than 75 years. We are today involved in travel in different parts of the world. My colleague Robin Ingle is in the World Travel and Tourism Council executive. So he's very committed and interested not only in travel insurance per se, but just also in the promotion of travel in general as something that brings us together and creates a global community. These are some of the things that we do because really when we talk about travel insurance is a financial solution that it's good to have. But then when things happen, we also need help. And so Ingle is not only involved in securing travel coverage, but also involved in how that assistance is provided, how medical claims are handled, and how all the service around experiencing a medical claim works. So that's Ingle in a nutshell. If we can go on, we're going to talk a little bit about travel medicine now. First of all, go to the next. Okay. So in each of these topics, we're going to talk a little bit about what happens before you travel, during travel, and even in some cases when you come back. Before leaving, it's important.
There we go.
I think this was actually mentioned in the introduction. It's important to talk to your doctor or health clinic, even up to a year before leaving on your trip, to learn about preventative treatments, vaccinations, precautions to take. The earlier the better, because there are certain aspects that might need time. And of course, as we well know in Canada, basically, consulting your physician, consulting your healthcare providers can take time. So it's always good to leave enough time. Certain countries require international vaccination records and updated vaccination against yellow fever. Healthcare professionals can advise on the mandatory and recommended vaccination for your specific travel destination. These are general tips on the right-hand side. Obtain good travel insurance. Bring a list of people to contact in the event of an emergency, including your doctor. So carry that information with you. I think having key information on your health with you is useful because you may need it while you're traveling, and also it makes it available to anybody who's traveling with you or who might have to step in and provide assistance while. Create a medical kit. This is interesting. One thing about especially traveling out of country to different parts of the world is it's easy to assume that we can find everything that we have available here easily, and that's not always the case. In different parts of the world, the rules on which medications are available over the counter, which are prescription, change. Prescriptions aren't necessarily understood or accepted from one country to another. So creating a medical kit contains fever and medication, aspirin, ibuprofen, antihistamines, anti-diarrheal medication, anti-emetics for vomiting, electrolyte salts, sunscreen. Sun-related risk is increasingly problems. So it's important to have that protection. I don't know if anyone here has experienced that, but a day on the beach can be ruined by not enough sun protection. Wound treatment supplies. So having a first aid kit with you is a very good idea. People suffering from a chronic disease must bring enough medication and supplies such as syringes for their need during the stay, as well as a medical certificate justifying their use, because of course, carrying some of these supplies could be problematic if you can't justify that you need them. Prescription renewal must indicate the name of the active ingredient, type, and dosage rather than the brand name, because again, brand names can be different across international borders. Very important to have adequate supply of medications on which one depends, whether we're talking about immunosuppressing drugs, or it's very important to make sure that that is going to adequately cover the time. We go on to the.
I'm just going to add,
Sure.
I'm going to help you out.
Yeah.
I think all of us know, we're all pretty attuned to making sure we have the right. Can you folks hear me? No, them, not, I don't care about you. Anyways, the online people, it's
Yes, I
important.
can hear.
Awesome, June. Thank you. So it's important that we have the medication, but I would suspect that your transplant coordinator has told you, if you're going away for a week, we pack an extra week. Have you guys heard that before? Okay, good. We're more susceptible to skin cancer. I think everybody knows that. So we're looking at SPF 50 or something of the sort, as opposed to oil, right? We're not baking out there, right? Okay. Yeah. So if you haven't been referred to the dermatologist yet, you will be shortly. And we have a question. So I just thought that we always need that extra medication. And as somebody who's actually traveled and actually had to use medical services, I can tell you firsthand. Let me put it to a different way. Have any of you gone to a walk-in clinic here? They look at you when you're a heart transplant patient as if you're an alien. Okay, that's here in Canada. Just imagine anywhere else. So that was the feeling I experienced personally, is they looked at me like I was an alien. They did not want to touch me. I ended up calling long distance and speaking to the team here at that time. So just to give you some context on my own personal experience from that. Hold on, we have a question, I think. Yes, we can hear you. Oh, thanks, June. Okay, let's keep going.
Actually, I have a question. When it says medical certificate justifying use, is that the letter that we get from a transplant doctor? Is that what that's meant, or is there a specific?
Travel letter. Yes, you need to get a travel letter. It'll have all your blood work, your medication, and your most recent tests.
Okay, that's what's meant by medical certificate for that particular drug. There's not sort of an out-of-country certificate we need to be able to show that we can take. So say you go to the airport, they're like, oh, I see you're on tacrolimus. You need a certificate to take that. Do you have the certificate? Is that something that's specific to?
So there are three parts to this. The medical certificate, part of it is to have documentation that explains and can be interpreted or understood by a medical professional where you travel. Whole other issue is having that translated, etc. But at the very least, having it even in your original form helps. Another is any potential refill prescriptions. Again, and I completely agree. At some point, we may have all experienced this, where filling a prescription abroad can be problematic. So really the best and essential tip here is to just foresee enough medication. The other thing too, an additional week, travel plans can unexpectedly change. You may find that your return is complicated by weather conditions or any other kind of problem to return, and you have to stay extra time. So you want to make sure you're covered. The third, I guess, is really just to foresee any required health-related certification, which typically will relate to vaccines. We're past.
I think you're on the next slide now.
Oh, am I? Well, yeah, here. I mean, the COVID vaccine, for example, is something that is not required in a lot of the world right now. But what we also experienced when we were going through the global pandemic is that these rules could change very quickly. So having your vaccination records is also very important. But here, before leaving, we should look at the destination we're traveling to, have local emergency telephone numbers. 911 doesn't operate everywhere. Foreign affairs travel warnings. The Canadian Embassy and consular offices provide that information around the world. So wherever you're traveling, whether it's political or personal security risk, whether these are weather-related advisories or advisories really of any type. I live in Mexico, so I'm receiving constantly information on where it is safe and not safe to travel. So getting that access to that information is important. If you're planning on spending a longer period of time outside of the country, it's a good idea to actually make sure that the local consulate knows that you're there. They will then be more able to assist you if more generalized problem occurs that requires you to receive assistance from Canadian consulate. Healthcare providers, clinics, hospitals, which have facilities that you need. Fortunately, it's now possible to really research and find information on health facilities pretty much wherever you're traveling. So it's not a bad idea to know where I might potentially go if I needed medical assistance. Bring personal health record information related to illnesses, surgeries, medication, and descriptions of any ongoing treatments. So again, we kind of look back at what we've reviewed. You might want some supplies, you want your medication, you want records, and then you want to also look into where you're going to be going. Sounds like a lot, but ultimately, all of this is designed to make your travel experience easier and less worrisome. Please.
Yeah, the only, just from a practical sense, never pack your medications all in one luggage. Spread them out. Carry on, check in, whatever, but never all in one spot. You're a connecting flight. Might have your meds, like you don't want to get into that situation.
I'm really glad you mentioned that because a number of years ago, precisely a colleague is a kidney transplant patient made that mistake. And fortunately, the check-in luggage was delayed. So I completely agree and appreciate that it is very concerning, unpleasant to be spending sort of 24 hours worrying about medication that's not available because it's in a check-in baggage that didn't show up.
I just have a comment about medication. My son went to Japan and one of his ADHD meds he takes is illegal in Japan. So he wasn't allowed to take it with him. So you might want to check those things as well. I don't know how you check, I guess, whatever. I don't know how he found out that it was illegal, but he was at the airport and he was looking something up. And thank goodness my husband's friend works at the airport. He said, "Oh, crap, I can't bring this with me." I mean, I'm sure he could have taken it and they're not going to search it, right? But you can't bring that drug into the country.
Yeah, that's a really interesting
Yeah, we had no clue.
point. Yeah, so this is another strong reason why it's important to have the documentation because in some cases it might be an attenuating factor that you actually need that medication. It's a justification for having it with you. Very, very good point. Yes. Wow. And I would guess that these are things that you can also look up. You can.
Yeah, and it's probably something in the medication that don't have it in the country or something, you know what I mean?
Yeah, or simply approval processes in different countries. Not all medications, medications can be unavailable for a number of reasons. Again, I can certainly refer to Mexico, for example. Mexico is experiencing since the pandemic, a little bit supply chain and procurement a problem in availability of a lot of medications. So it's important to have what you need. But in this case, also, you might even find that you have to consider or identify certain alternatives right now. Okay. At the destination, again, sun. In warm countries, the sun represents one of the main dangers. Avoid activities during the strongest hours of sun. This can be skin-related risk, but also simply the risk of sunstroke or stroke. Wear protective sunglasses, sunscreen, hat, long sleeve clothes. Stay hydrated, drinking water regularly. Showering or sponging also helps to fight against heat. Okay, on the right, I'm just going to go over this list because there's some pretty useful pointers here in terms of drinking water. Canada is fortunate in that we can more often than not safely drink tap water. This, as you likely know, is not the case in a lot of parts of the world, and there are a number of pleasant health risks that can be associated with drinking unsecure water from unsecure sources. Don't drink water from wells or streams. Do not consume tap water, not even to brush your teeth. Ice, reheated food, or raw foods such as salads, vegetables, seafood, or fish. Wash your hands before eating. Only consume properly and recently prepared dishes. You preferably eat pasteurized dairy products. Peel vegetables and fruit. For raw fruit or vegetables, apply the rule: if you didn't peel it, don't eat it. Avoid walking barefoot to avoid injuries or bites by venomous animals or even an infection by parasites. Avoid all direct skin contact with the ground. Use lounge chairs to tan. Avoid bathing in fresh water or walking in mud and puddles of water. Well, food is a big part of the adventure and experience of traveling. It's one of the highlights of a trip. So again, food is something that can be researched and looked into ahead of time. So may be able to identify even a wish list of certain places you want to eat, certain types of food you want to experience, and then you can also get locally advice on where to go and which places are safe. Important also be clear on any potential food allergies. Increasingly, places will ask you about that, which is a good thing. But don't assume necessarily that a food is safe. You don't ask, because sometimes there are hidden ingredients that might trigger an allergy. Again, we can find out about that. There are parts of the world too where, in addition to sun protection, you might want repellent, etc., because of certain parasites.
Excuse me?
Okay.
Question.
Yeah.
Why should we avoid seafood and fish?
Personally, I'm unable to avoid seafood. I love. So I think maybe the concern here is simply how it's prepared, what it's been exposed to. Often a combination that is dangerous is extreme sun and shellfish and this kind of thing, and they've been out a long time. To go bad, but again, I think
That could apply to anything, right?
it can apply to anything, and really the recommendation would be just to be particularly careful about where you're eating. I wouldn't discard getting local advice and pointers, because typically people at a place that we're visiting know where it's safe to eat. And Mexico, we love tacos. Very kind of basic rule of thumb is probably you don't want to go into an empty taqueria. You want to go into the one that's full of people that know that it's a good place to go and that it's safe, right? So
But even salads, like if, say you're gone for a month, you shouldn't eat salad for.
well, I don't.
What about washing?
Depends on how it's washed, yeah.
Yeah, you have to wash, right?
I also think it depends on your destination, right?
Yeah.
Right, you're in the US, you should be. No, you're in Cuba, well. Good luck.
Cheers, take care. Now, the message here is make sure that whatever you are eating that's fresh is adequately cleaned. You can get these iodine or chlorine-based solutions that you can put in water to clean fruit, vegetables, etc. It helps.
I think you summarized it best. If you go to a place that you know there's people there, it's probably a clean establishment as opposed to it's empty and you see a few people.
Yeah.
Yeah. No, and again, I mean, eating is part of the adventure, so it's something you may want to look into. Learn about certain places, which don't have to be expensive. This is the interesting thing too. It's Google can give you listings of restaurants and places to eat at all of those places. There are marketplaces. Okay. Upon returning from a country that is at risk for malaria, the prescribed treatment must be followed until it is finished. Any fever that occurs up to a year when you're returning from the malaria is evaluated by a physician. Malaria can have long effects. Generally, it's best to consult with a physician if you know or any other particularly when taking notes during course, again, this is an area where I think the global pandemic taught us that after travel. So it's important. Okay. Yeah, I like this a lot. I think, one thing that, going through a major health event, obviously raises our guard. Makes us more cautious. Can, if we're not careful, make us less adventurous. And I would like to leave a message with you that travel allows you to experience new places, connect with loved ones, you can take a break from your daily routine. And the good message, the good news is that it's increasingly easier to travel with disabilities. The world has gotten better at dealing with all kinds of different needs related to health when we travel. So you just have to be prepared. But I would definitely encourage put preparation, plan, information as your key weapon against the fears that you might be feeling about wanting to. When you have a disability, consider the more time you can take to prepare for a trip, the better. You may need time to ask your doctor about travel restrictions or modifications. Some of this may sound a little bit repetitive, so if there are any we're going through, we can mention them, but getting the paperwork, doctor's notes about your medical condition, research the airline. This is interesting to make sure that your mobility device will fit through the cargo door. There's an accessible washroom on board. Any other electronic equipment, etc., is cleared. Airlines are another, if you will, another gateway where you may be asked for documentation related to what you specifically need to carry with you. So it's important to have that. And
Can I maybe put a plug in here?
pardon?
Can I, put a plug in for, say, if you are, if you haven't traveled yet and you're a post-transplant recipient, John's talking about all the preparation, but it's homework, right? It's work we need to do. One of the things you may want to consider is maybe an experienced travel agent, right? I know there's lots of websites that can actually do that, but considering our own unique situation and circumstances, having a travel agent might actually add some value in that sense. They can provide insight on whether it's an airline or the location you're going to. So just thought I'd put that
That's a
in.
great idea. Yeah, no, absolutely. And also other people who have traveled with a similar condition and have experienced, ideally, you can find someone who may even know the place that you're going to.
I guess what I'm really hearing is each individual has to prepare their own risk assessment. Prepare your risk assessment. Yeah, like where you're gonna go, et cetera.
100%. But, if you think about it, Dr. Ross has taken Dale all over the world. So the amount of preparation that they have gone through is insane, right? And so they're doing some extreme adventures. That's different, right? Unless you decide to follow in their footsteps, by all means, more power to you. But if you are going to Florida, you are going to a Caribbean destination, you're going to Europe, it all requires planning. Right? It's not something that, unfortunately, we're not in the position where we can just, live life freely and pick up and go tomorrow, right? It requires a little more planning on our parts because of the situation we're in. So.
Great. And a way to look at it, travel is also an investment. It's an investment experience that you want to invest most out of it. So take that extra time to look into it. in a way, same applies simply to enjoying the destination. It's very different. How you experience a place, if you've had a little time to read about it, where you're visiting, what you want. So, I'm guessing when you get the presentation, this link is probably hyperlinked, and I'll take you right to, there is information provided by the Canadian government on specific tips and advice on traveling with disabilities. There's the comment on the travel agencies, and I think that's a great idea to get direct help from people who experience. Yes.
Do you go to a travel clinic to get your vaccines? And if so, because we're on so much meds, should we also be consulting with our cardiologist? Like, who would actually be doing that? Because sometimes the travel vaccines might not realize that the meds we're taking would affect us.
I'll jump in.
The question is consulting your doctor about the information given a health, absolutely. Yeah.
100%. Anything we take, right? I would talk to your transplant team. I would talk to the transplant team, right? I'm planning to take, what is it? Is it have A, B, V, C, all of that stuff? What's the Twinrex, right? But I know in my situation, they said, yes, go take it because I was going to a Caribbean island. So, Natalie?
The hospital, but they told me go to a travel clinic. They're well versed in as long as you give them your whole list of medication, they're well versed in what you can and can't take. So if you go to the travel clinic, make sure that they have your whole list of meds. And then they are well versed in whether you can take it or not. But you can confirm if you want with the people here, but they're.
In terms of sort of the hierarchy of advice, I think always. He's the one that you want to absolutely get to clear. And this can apply also to, we talked about vitamin supplements or other things that you might consume. Can you be exposed to the sun? These kinds of things. Get all that advice beforehand from the most trusted source that you have, which is your.
I'll add one more to that. Your pharmacist. That's actually what they're kind of trained to do, right? So, they're there, they're available, you use them, right? The more people you're talking to, the more comfortable you might feel before you leave for a trip, so.
Local transportation, et cetera. Again, depending on where you're going, you probably need to be less concerned about this, but it's one other thing that it's worth kind of figuring out ahead of time. You can often prearrange transportation. Some of the rules of thumb that apply where you live may not be perfectly applicable. In some places, you might consider Uber safer than traditional taxis. In other places, the opposite might apply. So it's important to kind of study that. Next,
Yep.
Whether you travel by air, train, bus, or ship, it goes much more smoothly if the operator has 48 hours notice of your disability related needs. There are several reasons why this makes a difference. An airline may need to ensure there are staff on hand to help you transfer into a seat, assist you at the pre-board screening checkpoint, or carry your baggage. Staff can make preparations to pre-board you ahead of passengers without disability. The ground transportation operator, such as the bus company, may need time to arrange for checks with the vehicle. Staff can prepare in advance for any disability related needs to bring with you, such as a power wheelchair service handler. I again share personal experience on this. It's always a lot harder and can be a little bit disappointing. Try to figure these things out as you're walking through them. Some airports, you don't have to have a serious mobility issue to need assistance to get from A to B, because in some cases, distances can be really significant. And sometimes your connections don't sort of factor that in. You can find yourself having to cross, even here in Canada, Dorval, which is an extraordinarily long airport, to get from one gate to your connecting flight, and you may not have enough time, and you may not have enough energy to want that assistance. The motorized vehicles are available, but you have to know where to find them, how to find them, and in many cases, you have to sort of rearrange that. Wheelchair assistance as well, boarding, e-training, et cetera, all of these things. Let them know. And also when, where you're arriving, make sure that it has all the necessary amenities to consider. Mobility or other ones. If you travel with your scooter, walker, syringes, or hearing aids, or pacemaker for that matter, here's some tips to keep in mind. You are permitted to bring any disability-related aids or need, and these are exempt from baggage or carry-on restrictions. All medication that usually includes syringes should be packed in your carry-on. Again, if you have an internal device such as a pacemaker or cochlear implant, inform the screening officer at the security checkpoint, because you will set off the alarm. Bring medical notes for syringes, prescriptions, and internal devices, or any area you might need documentation to support your disability. You won't be required to remove hearing aids or get out of your wheelchair for pre-board screening. If you can't go through the metal detector, you can request that your search take place in a private area. Remember, you aren't obligated to share personal details about your disability, but do be specific about the assistance you require and arrive early. If you'll need help at pre-screening or for boarding, give yourself plenty of extra time. It's always easier when you're the first person to arrive to board a plane, take a train, bus, whatever, than if you're doing it in a hurry. There's more time to do everything, and there's more availability of personnel to assist you as well.
There is one medical device that's not on there that I personally use. It's a CPAP machine. And you have to actually bring that as a carry-on. So, I've probably had more challenges with the CPAP than my own medications. They don't even flinch on the medications, but they've sat there and examined the CPAP machine. So, that's the only other one that I didn't see there that, I know that some of you may be using. So, just add that there.
We shouldn't take it personally when there's eyebrows raised, questions about hearing. With us, ultimately, airlines or travel providers are worried about safety. They don't necessarily know what we know about taking with us, and so again, it's good to have clear and even better documented information. Okay, travel assistance. What to do if ill or injured while traveling. Traveling abroad can be a thrilling experience filled with people, unique foods, and sights. But if you find yourself having a medical emergency in a familiar area, the experience can become overwhelming or downright scary. There's no need to cancel your trip for fear of falling ill. Keep reading to learn what to do if the unexpected occurs. We're going to find out. In addition to getting vaccination and purchasing the right travel insurance, you should always check to see if any travel health notices exist in your destination. These notices are provided by Travel Canada, and they're updated regularly. You should also check if there are any travel report warnings for the area you will be traveling to. You may want to consider registering for the Canadians Abroad Service. The Canadian government will contact you and may provide assistance if there is an emergency while you're abroad, or even a family emergency back home. Visit the Foreign Affairs and International Trade Canada website for more information about this service or to register. So again, an important message in all of this is that conditions can change. Related to local political conditions, related to weather conditions, depending on where you're going. That can be a major factor, or simply other situations that you can encounter. So it's important to registering gives you the advantage that you will then have access to information. If you have a handheld device, you'll be that information while you're traveling. You'll get important updates. Pretty much all carriers traveling by air, they will ask you for emergency contact numbers. To give those people know how to reach you. What to do in a medical emergency? First, try to get help through local healthcare resources. Few important notes to keep in mind. Your hotel may offer in-house physician services or might arrange an appointment with a local physician. For urgent care, always go to the nearest hospital. If you have purchased travel insurance, contact your insurer as soon as you are medically able. Most insurance policies include 24/7 emergency assistance services that can locate care, arrange payment, and notify family on your behalf. In most cases, your policy may require that you notify your insurer as soon as possible, usually within the first 24 to 48 hours of seeking medical care. It's a good idea to contact your insurer to find out requirements before your trip. So this is for two reasons. One is to make sure that your insurance provides all the assistance services and emergency services that it can to help you. And the other is to make sure that your insurance works for you as best as possible. There's a reason why insurers want to be advised, because that way they can intervene, work with your healthcare provider to assure that you're provided with the correct care, and also to ensure that the healthcare provider is providing the care under the appropriate conditions in terms of cost, what it's charging, etc. The insurer needs to know. So it's good to let them know. You don't necessarily have to. If you're in an emergency situation, and you require emergency medical care, the insurer wants to know as soon as possible, but somebody can also call them for you. So the important thing is to just remember your insurance when you have to seek emergency.
If I may share a personal experience, one of the things that I didn't know, because I thought it was more like Canada. But when we go to the hospital here, doctor, give our OHIP and it's covered all the way through. But when you're in the States, the radiology place will bill this location, which will bill that. So you have to make sure you give that information to everyone, because you will end up getting bills a year later saying you owe this amount of money. Of course, the insurance company come through and they cover it all, but it's just a hassle because you get that and you start panicking. Well, like, $50,000 bill, what's this for, right? So just to be cautious in your mind that you have to give everyone. It's not just one time, give the information that transfers all the way through.
Yeah, remember that as Canadians, we're privileged to live under a universal healthcare system where we don't have to think about, while we're receiving medical care, what it costs or we have to pay. In different parts of the world, this can play out differently. The United States is acknowledged to be perhaps the most expensive healthcare system in the world, and private health bills can escalate very quickly. In some countries, this is the case of Mexico, you don't even get released from the hospital until you pay. So that can be a really solid reason to get your insurance involved as quickly as possible, because approving claims and arranging payment to healthcare providers can take time. So the quicker you start to act on it, the more time that's available for that to get sorted out. You don't want to find yourself that you're ready to be released medically, but you can't leave the hospital because payment still has to get sorted out. And this is a very real scenario. Again, we don't think about it as much because we're lucky, we're blessed here with it does cost, it does get paid, but it gets sorted out afterwards. And it's pretty much handled in many cases through or taxes. So
Couple of comments here. If somebody comes to Canada, your family member, and they don't have travel insurance, they're gonna be, and they need medical help, they're gonna be sticker shock. So you gotta think of that for any friends, siblings who are coming to visit you. They don't get universal health care, right? So first and foremost. And to bring this full circle, when Robin did this the first time many years ago, Robin told the group back then, and Robin's at the back of the room now, by the way. Whether, correct me if I'm wrong, Robin, a bypass surgery, this is why you need the insurance company involved right away. A bypass surgery at the Cleveland Clinic, I don't, the numbers are probably
Yeah, no, that's good, that's good.
right, might cost $100,000, but in Los Angeles, it might cost $300,000.
Well, if you go to a healthcare facility in the US, what they'll do is they'll boutique out the emergency room and the surgery to a cardiologist, for example. They don't do cardiology. But if you go to Cleveland Clinic, you're gonna pay, for example, you can buy a surgical package, an insurer could buy a surgical package. And it might cost today, in today's numbers, I think then it was 25,000 US. Today it'd be about 50,000 US for a surgical package for a triple bypass. But if you went to a non-cardiology hospital that rented out its surgery to a cardiologist, that price could be 800,000. It's a crazy number. We had a case in Straub Clinic in Hawaii, in Honolulu, and it was for an 80-year-old who was unstable, who was a teacher from Vancouver, who ended up in the hospital. They decided they were going to do a bypass because they do more intrusive surgery in the US than they do medication and stabilization. So they did the surgery. It was 800,000. They had to go in the next day because they actually made a mistake the first time, and they charged us twice. And unfortunately, the poor lady didn't survive after 6 weeks because they didn't really do a good job. They're not known cardiologists. Cleveland, though, is. They do a lot of them, so they're really good at it. So Miami Heart, for example, you'd rather go there than you would go to a Fort Lauderdale hospital that doesn't do cardiology. So the insurers do know, and they can direct you. And that's where the emergency assistance comes in.
And there is another story. There's an individual who went rock climbing that I know in Czechoslovakia, I think it was, got injured. She was young, and the doctor wouldn't do the surgery till he was guaranteed payment. So that's where the insurer got involved. And so I don't think that was a life-threatening situation per se at that point in time, but it is something that
One of the highest charging ICU rooms in the world that I've seen is in Halifax for a non-resident. 17 to 18,000 Canadian a day for the bed. That's for a non-resident, somebody not covered under a provincial health plan. So think about that. So what we do to non-residents, the Americans do to everybody. So it's very similar kind of thing.
Yeah, that is, thanks for bringing that up. Someone is visiting you in Canada, they need to get insurance to essentially have access to what we have.
Yeah, I almost ran into a scary situation where I work in education. We entered the March break and I had a needling procedure on a wart in my foot. I went to an education conference in Atlanta, Georgia that week, and I noticed my foot was getting irritated, perhaps infected. Now, I'm fully covered by work, but when I called my work insurance, they said, did you wait the requisite 6 to 8 weeks after a medical procedure to travel? And I said, no. And they said, you're not covered. So now I'm a heart transplant guy in Atlanta, Georgia, gonna walk into a hospital, ka-ching. Right?
You'll see actually
Yeah.
later in
Yeah.
these slides, you'll see, because I actually mentioned that.
Okay.
Because one of the things, if you don't follow medical procedures, some companies will use that as a reason for not paying the claim.
Okay.
So, and what you can do though, I can tell you, like, we also have an emergency travel assistance claims and cost containment group. One of the things we've done for people, if they weren't covered, is we will actually cost contain their bill for them. So an insurer like us will pay 45% of what is actually billed to you. So think about that. So they'll bill you 100,000, we'll end up paying 45,000 because we've got to deal with them, or we know how to negotiate, or we know how to audit their bills. Because they do, like was said before, they charge you for everything.
Yeah.
They'll charge you $6 US for an aspirin. You know, if you have to have an aspirin as a minor blood thinner, they will charge you $6 for that. A pair of surgical rubber gloves can be $40 US for one pair. They'll charge you on the bill, and it's an itemized billing from all departments.
We've done this in different parts of the world, the Middle East and Latin America. A lot of times what happens too is the healthcare provider is sort of the bigger the wallet of the payer looks to them, the more they're prepared to charge. And so they.
I hope that,
So Robin, if I travel to another province, go to Halifax,
Good point.
do I need to get additional insurance?
Yeah, a really good point, because what happens is the province will pay for the costs that the province pays in the province. There are reciprocal agreements between the provinces, except Quebec. Quebec has an alternate agreement with the provinces, the other Anglophone provinces. One thing that's not going to be paid, if you look at people going skiing in Whistler, for example, they forget this, like from Ontario. If you have to get air evacuated to Vancouver, the air evacuation is not covered. Province won't pay. So there's certain costs that are not covered, and you can get in Canada travel insurance. It's a lot less coverage because there's not a lot you have to cover. It's just the differences between it, but you have to be careful. You go to Quebec, for example, you'll end up with a clinic. They might charge you and you have to get reimbursement back from OHIP.
So is there a site that we can go to get that information?
We're getting there.
Provincial government, so like, if you go to OHIP's site, they'll have information about the other processes.
we were in the United States and, there was a room here in Peter Monk. They wouldn't fly us because it was the Thanksgiving weekend in Canada. They couldn't get a hold of her family doctor because to determine if it was a pre-existing condition.
Right.
So they told me if I wanted to get it back to Canada, I had to pay $48,000 US. I said, how do I do that?
Was
They
it
said,
for,
"Credit card."
was it for an air evacuation plan?
Yeah, I said, who has $48,000 on the US? So they're fortunately, as here, they have teams. One of them overheard me talking because I was in the hallway, and she said, oh, don't worry about it. As soon as they get our first bill, they'll be wanting to fly. Because there was no pre-existing condition, they don't want to fly
Right.
that way. But this will lead me to a question that I hope gets addressed. We live, unfortunately, we're in a world where technology is the end all and be all, and press 1 if you're having a heart attack, 2 for stroke. And unfortunately, I know we're getting into the insurance thing, but all of us need comfort.
Yeah.
I really don't want to do an insurance if we're going to travel abroad and start doing it online. I'm hoping you will address that. We can come into your office and do this with you. So we have comfort. We may do it right online, but unfortunately, you're going to be sitting if something should happen and always wonder, did I do something wrong? Because it may not be
Actually
covered.
address that, because
Good.
I can tell you, you're not the same audience for this, but if you're dealing with typical snowbirds, for example, we'll ask them, do you take any prescription drugs? Right? First of all, we've asked them, do you have a pre-existing medical condition? No, I'm great. Do you take any prescription drugs? And they list off like 5 different drugs. You know, they've got hypertension, they've got blood pressure, they've got all these things they're throwing out. And you're going, well, you actually do have a pre-existing condition. So if you don't answer correctly, then you're going to run into a problem. So for example, I've seen people that didn't mention that they had diabetes, got sunstroke, fell and hit the concrete, and an insurance company didn't pay because they found out they had diabetes. So they don't know whether the person had a problem or whether it was sunstroke, like what was the problem, because they don't know. So that'll come into it. It's good also what you're mentioning is talk to somebody. You don't have to do it all online because you've got a unique need, right? So you want to be able to actually talk to somebody, go through it. And one of the things we mentioned in here is get it in writing. So if you're on an employee benefit plan, and we'll go through this stuff, but if you're on an employee benefit plan, talk to your benefit administrator. So talk to them what that coverage is that you have for that period of time. If you've got a program like teachers, for example, you know, you've got union programs that are there, talk to the benefit administrator so you understand it. If you're talking to an insurance group, make sure you understand the product. If you don't, ask questions. Okay, people, we are terrible at understanding healthcare and understanding financial products. I can guarantee you, nobody knows what their credit card really does if they don't do something, right? You take that book that they send you, you throw it away. Nobody looks at that damn thing. It's like 40 pages, right? So with insurance, this is where you have to be prepared. The same as when you travel, be prepared. And just so you know, I've got a total hip replacement on this side, so I beep every time I go through, and I travel a lot. I had, when I was in 1987, I had a sick sinus syndrome. So my heartbeat went from 20 beats per minute to 200 beats. It was just boom, 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 like crazy. They wanted to put a pacemaker in, it was pneumonia. So I understand those things. That's why a lot of the businesses I've been in is health related, is insurance related, assistance, helping people, because when they're away, it's a problem. You don't know what to do. And you don't want to stop your life. You know, it's hard enough when you had the surgery, you're sleeping at nighttime and you can't sleep, right? Because you don't know if you're going to wake up in the morning. It's that feeling you have. You have to get through that. You have to get through that side, and you want to be able to travel. You want to live. So this is where you need to take charge yourself. No one else is going to do it for you. And I know it's hard, but ask the questions, get it in writing, be prepared when you're doing it. Okay, go. By the way, yeah, travel tools.
Go ahead, Robin.
This is one of the tools we created. It's called Travel Navigator. We only sell it to large organizations like insurance companies for their clients, and that kind of thing. But what it does is organize all of the information for a traveler into one app. If you've seen your phone, one of the worst problems is you've probably got 30 different apps you've downloaded and you probably use 3. So we knew when travelers, they didn't know about the risks. They didn't know about medical information. They didn't know how to get a hold of the travel assistance. We put everything into one application. And this is just to try to solve some of these problems that we've been talking about. So there are tools out there that you can get that can make your travel easier.
Do you get any general information to specific phone numbers and details on the insurance coverage?
I'm going to add a plug here. If you have travel insurance, whether it's the teachers or it's any company, group benefits insurance, you need the travel card that they provide you. There's a 1-800 number that's on that card. And that's the insurance company that your respective company has chosen. And so you need to print that. You can download it probably and put it to your Apple ID or Google phone, but that's an important phone number to have downloaded, or card to have downloaded, so that you can contact, or somebody you're with can contact them. So.
Good point also to make sure that, little tip, try to have downloaded information on your handheld device versus, I don't know who, like I sometimes do, uses their email as their filing system for information, but you know, if you don't have internet access and trying to look for it, it's complicated. You might not get access. Get that information as available as possible offline on your and physical copies.
Okay, travel insurance.
All right. So
Oh, forgot to hit it.
Get all the fine print.
yeah, this is where the presentation has very small writing. No, there are 2 types of coverage: travel medical, which is health component, and non-medical, which refers to trip cancellation, interruption, baggage. This is provided for unforeseen events not under your control. Again, trip cancellation coverage, which existed for a long time, became very front and center as a result of the global pandemic. All of a sudden, things had to get canceled, things had to get changed, and this sort of coverage became very important. All major travel insurance products include a 24/7 emergency medical travel assistance service that can be reached by phone, email, or through a mobile application. Travel health insurance is an important product for any Canadian traveling inside Canada, especially to high-cost healthcare regions like the USA. Again, even if you have travel benefits through your employee benefits or group benefits, you may find that you need to complement that with additional travel coverage. It may not cover 100% of your costs, and also it may not provide all of the same services. So this is why you have to ask about your group or employee benefit coverage. You're entitled to that information, and then once you have that, it will give you the possibility to make a more informed choice as to the additional travel coverage that you need. Medical emergency in the US can easily be over 500,000. To stay in a hospital bed over 5,000 per day. We already saw even higher than that. But like all things, you need to understand what you're covered for. There are also experts who can provide you the right product to fit your needs or the best available product in the market. And yes, I think just like any other financial advice that we seek out, it's completely valid to get someone that you can talk to that can provide you advice and answer your specific questions. Travel medical health insurance covers unexpected, unforeseen emergencies. This includes accidents and illnesses. This does not include continuing care, preventative services, routine checkups, maintenance care, elective or non-emergency services, or diagnostic services unrelated to your emergency. So, in a way, this has kind of gone full circle. We started talking about planning for travel, and particularly planning for travel given your particular health conditions. So, what ultimately happens once you look at travel insurance is that planning process becomes very important, because it will also help you determine what you need to do before you travel. There may be certain steps, checkups, things that you want to get done before a trip, because precisely it'll be more complicated and will more than likely not be covered through your insurance if you try to deal with these things while traveling. We talked about prescriptions, medicines that need to be refilled if they relate to a condition that's stable, that is pre-existing, won't be covered by your travel health insurance. So these are the kinds of things that we need to think about. Let's go on to the next. You need to have travel insurance. Trip cancellation insurance will provide compensation for the prepaid costs of travel arrangements if a covered event occurs. You become sick and unable to travel. You lose your job outside of your control. There is a warning issued by Foreign Affairs to not travel after you've booked your trip. Baggage insurance usually has a limit per items, will not cover valuable items, jewelry, money, and will have a deductible amount. A solid reason why your most valuable possessions should be on your person when you're traveling. It's amazing to see that this mistake is commonly made. People put valuables in a suitcase. Your baggage coverage will be limited. It's not going to cover extremely expensive jewelry that you have.
Slow point here too is if you've got homeowners insurance or you've got a condo apartment contents insurance, usually you will have a portion which is away from home, and it's usually about 10% of overall coverage. So, for example, if you take things with you and it's not going to be covered under the travel insurance, the baggage insurance and travel insurance is crap. Just so you know. It's better, you understand, don't take valuable items. When you go to the Caribbean, you go to Florida, you go to all these places, don't take a lot of, expensive rings, watches, things like that. That's just a target. You don't want to do that anyways. But you do have an away from home benefits, and you can talk to your PNC or property and casualty broker and ask them about that coverage, because that will cover if you took a laptop, it'll cover your phone. If you lose your phone, if you don't have another way to do it. So you do have that kind of coverage, but most people don't know it. Right? You'll see also kids, they'll have like a violin or something, they're going to a school concert in another country, sports equipment the same way, it can be covered under your PNC policy, your property and casualty home policy.
Your carry-on should have minimum of five things. Now, valuables, anything that's very expensive, money, electronic equipment, your medication, important documentation, so documentation related to your health, obviously your passport, but other IDs or credit cards, et cetera, should be with you at all times. And 5, something more, because some of these longer flights, you find that get cold. So in reality, you don't have to have a massive carry-on, because none of these things really take up that much space, but it's important to not put any of that in your stow-in. All right, pre-existing conditions are not covered unconditioned. There are limitations and exclusions to cover them. Most plans will require a stability period of time before the policy goes into effect. For example, 30 days, 90 days, 1 year, or longer. It also depends on the medical condition, the policy, the medical underwriting. This will differ from plan to plan. This leads to the biggest question about what is stable anyway. Many Canadians with medical conditions before leaving on trips will visit their physician for a checkup and are given a clean bill of health to travel. That's a good thing. But the physician's okay is not the same as is the definition of stable in the policy or the application for coverage. They serve different purposes, and it's important to know the difference. Have there been any new or recurring symptoms? Has a doctor determined the condition is worsening? Has a doctor treated, investigated, prescribed, or changed, increased or decreased medication for the condition or related conditions? Has the patient been referred for consultation to a specialist or tests awaiting test results? Has the patient complied with the doctor's directions, taken their medications, followed up on visits and referrals? Failure to comply with doctor's orders is justification in itself for denial of a claim. As Robin pointed out, not disclosing adequately pre-existing conditions and ensuring that they're considered stable when you travel can affect all of your travel. As we see here, it's not simply a case of saying, okay, I think I had this stable for long enough, hence I don't have to worry about it, versus actually getting the condition cleared for travel.
All the companies are different too, so that's no company's the same. So one of the reasons we have our own products, but we also represent all the major companies, is that we can pick and choose, because companies are slightly different depending on a situation. So you're going to find a product, like even if you've got something that's pre-existing and you're worried about certain companies, or maybe a company out there that will be better than the rest. May not be perfect, but it's going to be better. And as long as you understand what that difference is, that's going to be important. And the stable clause also applies, by the way, to other kinds of products, like your credit card travel insurance, your employee benefit travel insurance that you get. So you need to ask those questions and understand. The other issue that a lot of people have is they'll go see a doctor, and doctors, especially in Canada, are great because they'll say, look, it's better for you to be in the south. Go where it's warm. I don't want you to slip on the ice. I want to do that. That has nothing to do with the way the companies, the insurers, look at pricing and how they price a product or what they put in the benefits. So the problem is we get a lot of people will say, oh, my doctor said I'm great. And you go, okay, but you're waiting a test, or you're doing this, or you're doing that. So it doesn't really fit. So, and they don't want to find out afterwards. That's why do it ahead of time. Like, don't be afraid of this either. Like, it is what it is. You just want to make sure that you're got the right information before you leave. And that you've gone through these and you've made sure that you've actually handled some of these areas.
So I'm going to add a plug here. So when I first got my transplant, travel insurance was a real long shot. And I was very lucky to actually get some sort of coverage through a provider at the time. And things evolved and developed, and this is how I ended up meeting with Robin and finding his insurance, his programs and stuff like that, because they do cover transplant recipients. If any of you are counting on CAA to cover you, do not. It doesn't cover transplant patients. If I don't know about the visas and Amexes of the world, but they each have, to Robin's point, their own stability clause. And as an example, in my own situation, my medication was actually lowered. This was early in my transplant, a year out. So they sometimes lower our medications nicely. It's a nice thing, right? You're happy, and that would have disqualified me for any sort of any sort of travel insurance. So that's where I went on a hunt. Didn't find Robin back then, found him a few years later. And so, yeah. And that's where I've had Robin out before to talk about this, because there are some, depending on your age and your unique circumstances, some of the stability clauses are a little more condensed than 6 months. So
This is why, even though you can get travel insurance in 5 minutes online, this is not the kind of travel insurance that applies to those of certain discrimination. You need to give that additional time into making sure that the coverage is going to work the best possible for you.
So in prep for this, I've been talking to some people and they were going to St. Martin, and he just recently had a defib pacemaker put in. And he went to his doctor's, without talking to his wife, he went to his doctor's, and it was like about 9 days before their trip, and she was like furious. And why did you go 9 days before the trip? But anyway, he was able, fortunately, and I think you probably sell the same product. The stability period, he paid a premium on his insurance policy because it was a 7-day stability.
Yeah. That's
Yeah.
2 go. 7 days.
So do you offer that as well?
Yeah. Yeah, 7 days. You do have to watch those too. Some people go, oh my God, it's great, let's go for it, right? But you just got to make sure that it's correct, because every company changes every year too. That's the biggest problem. And just to give you a background on this, my family's been doing this since 1946 in Canada. We created a lot of the products you see in banks. We created those. We don't do it now, but we created those kind of products. I live part of my life in London, UK, and I live here. So John, Mexico City, and here. So we do, like, a lot of the stuff we're doing, we do globally now. Because Canadians, we had to figure out how to deal with Canadians going north-south. The American healthcare facilities, they really love Canadians. Go north-south, you go to Florida, you go to Arizona, you go to Texas, go to California. Those hospitals love the charge. So we had to learn and figure out how to create products as the provinces changed. I don't know if you know this, but if you go back that far, 1989 to 1991, that period of time, most of the provinces covered 80% of your healthcare outside of the country. They couldn't control it. So you can look at insurers as being, oh, those guys can be bastards. Well, the government couldn't control it. It was doubling every year, mainly because of the US. So, there are products out there. Just be careful. Be prepared, ask questions, and it's okay to do that now. Don't feel ashamed, don't feel worried, don't feel intimidated. If somebody, by the way, is intimidating you, don't work with them. They're not the right type of company to deal with.
Right, and there is a question.
Yeah, back here, hold on.
Sorry, I just had a question. Like, I'm a relatively new heart transplant patient, so I'm always in and out. Like, constantly. So does that mean nothing cardiac related would be covered by any plan?
No, but it means you have to be careful about that.
Okay.
Because naturally, before you do something, you want to check on it. That's the impulse, and that's what you're asked to do. The same thing when you're changing medications. Just what companies do is they try to work out, this is what's called underwriting.
Mhm.
So based on the information they get, they have history and they have general population information. And then they try to predict what kind of losses they'll get. So their loss ratio is the difference between how much money they get in and premium
Right.
and how much they pay out in claims. So they have to gauge that.
Okay, so here's an example. Say your creatinine is raised, so it shows maybe there's a kidney issue.
Yeah.
For a cardiac, like a transplant cardiologist, they're like, oh, we don't care.
Right.
Insurance company might look at that and say, oh, well, your creatinine was raised.
Right.
But for a transplant patient, that could be totally normal. They may have lived with that
Yeah,
for
now
years.
they may not even ask though, and this is where,
Okay,
so this is where you want to look at the nuance of the questions they're asking and make sure you don't fall into a trap.
okay.
So if they're asking, have you been treated? And you go, yes, I went to do this. And they say it's okay. This is why I say get it in writing.
Okay.
Even from your benefit administrator who has travel insurance, get it in writing.
Right.
Because sometimes they don't have it easy. It's like Eddie said, get your card so you get it from them, because sometimes it's not easy to find the travel insurance side of your employee benefits. You know, that's always been a problem. So find out if it's going to get them to answer those questions. If you're using a credit card, ask them the question. And then make sure that you're getting the right answer, right?
Okay, so basically in writing, yes, we will cover you for X, Y, and Z,
Right.
despite the fact that we are aware of X, Y, and Z.
You're gonna need to call 2-3 times sometimes. And that's where, whether it's that to-go product at 7 days or some of the other products that are out there, because most of these policies, there's a few out there that are 30 days, but there's a lot more that are closer to, say, 90 days, 6 months, and even a year for.
Some of them are even over a year. Yeah. But it's not like, just look at this as a game. It's a game of life. You've got to
I think
ask.
all of us take certain risks because it's like, well, we want to go on vacation.
Well, you want to live too.
Yeah.
You know, you've gone through all this, you want to live. So you want to.
There's another one there.
Yeah. What about the short-term trips? Want to do a day trip over to the States? And you're gonna drive?
Yeah.
Should you be taking out insurance for that?
You should, because if you end up in the States,
Yeah.
even if you go to New York State, you go to Ohio, you go someplace, you go, you know, Illinois. If you end up in a hospital, you could get a cost and it's not going to be covered by the provincial plan.
We're not, and the cost of these products aren't like astronomical, generally speaking. It depends, right? Everybody's situation is going to be different. But if, you know, it's worth the cost if that's what you're going to be doing, leaving the province in some shape or form.
I can tell you too, we have, like I said, if you're going to the US and somebody gets into a problem, even if you don't have our insurance, we do have a travel assistance cost containment group that all they do is they work for insurance companies and they audit the bills in the US. And that's where I said we're paying 45% of what's billed. That's why the US healthcare system's crazy, because, you know, off the street, you're gonna get charged a top rate. They call it reasonable and customary, and it's not, it's a top rate. And if you know how to negotiate and how to audit their bills and go through their bills, make sure they're correct, you're gonna be paying closer to 45%. So we'd be happy to do that for you. That's not a problem, because we don't want to see people stuck with that kind of a bill. So if you do run into a problem, don't hesitate. You can actually go through Eddie. You can go through our website even and connect with us.
The way to look at it is when you step outside and exposed to risks of all kinds, something could happen and it could happen on a single day. So often insurance plans will have a minimum number of days of coverage, but I mean, that doesn't necessarily mean that you have to be minimum of 5 days out of the month.
You know what? You can negotiate too. Don't hesitate. You can negotiate. When you're sitting in a hospital bed and somebody's charging a huge amount of money, just say, look, you know, I just don't have the money. I'll take care of this with you. Like, you can negotiate that kind of thing. Don't feel that you can't do that.
So a question that might come up is, you know, well, so if I have a pre-existing condition, is travel coverage still helping? The answer is yes, because first of all, you can be exposed to all kinds of situations that are not related to your condition for which you need coverage. Also, a lot of coverage will cover you for stable conditions, assuming those conditions have been met, period of time, et cetera. What they won't cover simply are those things that you would normally do condition. So you still need the coverage. We've mentioned you have to understand how the stability clauses work. Disclosure, companies will tend to, insurers will tend to penalize a lack of information. So the idea is the more you tell them, the better insurance will play out. What they have to assume typically will not work out in your favor. It's better to disclose. And this is also why you probably want to get your insurance in a more bespoke fashion, talk to somebody, get the advice, ask the questions. Don't just assume that because you weren't asked buying a policy in 2 minutes online that you're okay. I mean, you want to provide the necessary information. Policy to be written correctly. Medical assistance services provided in insurance policies will help in finding care, organizing admission to a hospital or clinic, arranging payment, contacting relatives, having multilingual professionals who can assist you in communicating, contacting your healthcare providers in Canada. Again, as Robin mentioned, we're involved not simply in how travel health insurance gets underwritten, but also in how all of these services are provided. So, these are important aspects to getting your coverage. It's not just the financial protection, it's also the different services and assistance that you can receive because you have that coverage.
Should have added on there air evacuation to return home, either in a regular scheduled airline or air evacuation. And you should know, you see sometimes these articles about a Canadian stuck someplace and they're upset at the insurer because they can't get back home and the insurer is terrible and awful. It's not the insurer. What happens is if the hospital here doesn't want to take them, they won't open up a bed. They say, you're taking care of there, finish off there. And that's a typical thing. So the insurer would love to pay. I can tell you from Southern US to Toronto, it's going to cost us on a Lear Citation jet. It's going to cost us $15,000 US for an air evac.
No, it's 48,000 US.
No, that's your retail price.
Oh.
I know, with a med team on it, depending on how severe it is, it may only be a couple thousand. So what happens is that's a Lear Citation jet. You don't want to get a King Air because it's going to have to make a couple of hops. But if you do that, it's going to cost us about 15,000 US to get up. So that's one of the things, like we cost it out. Actually, I've done that I had a reporter with a newspaper in Montreal who had a father had a seized back in the US and their price was quoted was actually close to what you're saying. It was about 45,000. We ended up taking it back for 10 grand. So it depends. Also, there's empty legs. It's nothing to do with the body, okay, but empty legs, they've gone someplace and they want to come back and they don't have a customer. So we can actually save money on an empty leg. And they'll have a medical team already that wants to come back up to Canada. So you get those kind of things. That's what insurers will do.
We have a question online. Deadline to submit a claim.
Well,
Because this,
it's 12 months basically after the event.
she's saying she only had 1 week to submit the claim.
No, that's not correct. But basically what the companies say, you have to notify them within a period of time when the event happens, but you can submit the claim for reimbursement up to a year after the event. That's what it says under the insurance law.
Now, she's in the US, so the US could be different, right?
Well, I I think legally, the US is pretty litigious. I think as a patient, as a customer, they pushing it to say 1 week. I mean, 1 week. When did the event happen?
I don't know.
I think Eddie, if you want to refer to,
Okay.
yeah, no problem. I can talk to them, because that doesn't make any sense.
Not really, no.
Okay.
And then, now, also, different types of dates apply, so it might be, as Robin mentioned, you might have a certain time limit to provide, notification, of an emergency situation that require help.
But those companies don't, they can't really do much, because when it gets to the legal side, you know, a judge would be really.
Well, I got a different question then. So we'll have there's Visa if you've bought the trip. There might be your group benefits plan. And as I've done, I've bought that to-go product numerous times. Who's the first payer or who's the last, right?
So that's called subrogation.
Okay.
So in insurance terms, what happens is who's going to be the first payer in a transaction. So it's related to how the insurance was bought or was packaged. So what happens, for example, and a clear one is you're driving to the US and you get into an accident and you've got travel insurance and you've got your car insurance. So what happens is the travel insurance group doesn't want to pay before the car insurance pays because it's a car accident. The car accident company, the property and casualty company will say, no, well, you going traveling, so it's travel insurance comes first for the medical costs. So what the companies do is they subrogate between them, meaning they negotiate between them on who covers. But the travel insurance will have the 24-hour emergency assistance. So if you go to them, they should be the ones that coordinate between the benefit plan, between what other coverage you've got, and they should organize it for you that way so that you aren't the ones stuck. Now, it doesn't mean it's always going to happen that way. That can get confusing.
Yeah, no, it absolutely, and it may depend also on the type of coverage that's involved. So for example, deductibles that need to get paid and not necessarily, additional coverage might not necessarily cover your deductible. So essentially, a rule of thumb is one thing that will never happen, shouldn't happen theoretically, is you can't kind of claim on the same expense in two places. You won't get paid twice.
So let me ask a question. If you're traveling by car and you're traveling to, say, Florida.
Yeah.
Does the insurance that you're providing for Florida, does that apply for all the other states that you're traveling through? Yes?
Yeah, if you buy travel insurance, it won't matter.
They just ask if you're traveling through the US.
How about if you're traveling through Canada, say, for example, I'm going to PEI.
Yeah. That's the reciprocal agreement between the provinces, so you might want to buy something to just cover the gaps themselves. But if you're traveling to Europe or you're traveling to the Caribbean, what the insurance companies will always say is, are you traveling through the US? Because the US is that can of worms that can cost significantly more.
That's right. There's two regions in the world as far as health costs are concerned, the US and everywhere else. There may be certain parts of the world that are excluded for specific travel coverage. I think that still applies, Robin, but that typically is because these are very high-risk areas to travel to.
That's a good point. If you do travel, if you're getting a connecting flight, for example, through the US. And you've got to make sure that the coverage will cover you in the US as well as wherever else you're going.
Yep.
Question, kind of going back to being stable. One of the things you mentioned is, do you have any upcoming tests? What happens, like for us, we often have regular echoes instead of standard. Get them every 2 or 3 times. Is that considered an issue?
Not necessarily, because it's like a physical, right?
Yeah.
You're basically just getting tuning, you're checking your heart.
Checking doesn't mean there's necessarily anything wrong.
No, but the testing, now you have to get clarity on this, but the testing is usually meant that you have a problem and the doctor says, I'm gonna schedule you
Okay,
for a specific kind of test because I see there's a problem.
okay.
So the insurer wants to know, well, why are you traveling then if you've got this test, right?
Routine stuff shouldn't be a
The
problem.
routine stuff shouldn't be, yeah, and
But disclose it.
That's a really nice example. Kind of thing where there might be a temptation to sort of say, well, I have a test scheduled because I might have. So why don't I travel now while I don't know, because then I'm gonna be okay and there's no problem. That isn't how it works. That's not what's going on.
I did that.
Sorry?
I left the country. I did that. That's insane.
You know, so, I mean, for other reasons, it might give you, peace of mind. You might be able to enjoy the trip more because, you don't have writing on the wall, so to speak, with regard to a medical condition, but it may affect how, or will affect how the health insurance, covers you because you did know that there might be a medical issue, pending. Yes.
Just to simplify the process, it sounds like when you want to obtain this insurance, they give you a number, your company, you have an agent or customer service rep that walks you through everything as opposed to doing your online application, or it sounds like something should be walked through with the policy item by item by one of your representatives. Does that take place, or?
yeah, usually we'll get somebody that knows, especially if you've got a unique need. We'll have somebody that's experienced at asking the right questions, going through it, and then being able to figure out what product is the best fit.
Perfect.
Yeah.
So you're not doing any online application then?
We do online because, 80% of the population, they're going off doing something, they don't have something they need. But we recommend that if you need something, then to contact us. And we'll actually get an individual to do something. And usually somebody in the area, it's an agent, a broker who does this all the time and knows what to ask, how to deal with it, what products to look for.
So your company's not the broker then? You're the provider of the product?
We're the provider of the product, yeah.
So you would recommend an insurance broker like I live in Leaside, so would you?
Yeah. Yeah, exactly. That's what we would do. And we would get somebody that understands the particular areas. So for example, people with medical conditions, you've got situations where you've got an older population that's traveling that has medical conditions. You've got people that have their own pre-existing medical conditions, and you've got people that have special needs that are different. We have people that want to go scuba diving. You've got people that want to climb mountains. You've got all these kind of things. Professional activities. Yeah, we've got people going to war zones.
I did that.
Going to war zones?
Yeah, I went to Afghanistan.
Yeah.
So, in fact, health conditions aren't the only reason why you might want to get, and also we work with a lot of, financial advisors, brokers, et cetera, because travel health insurance is a specialized need that, very often, their clients have to solve and that they don't necessarily know that much about. So
How much time should you give, like if you're traveling in the middle of April or the middle of May? You should probably get this all taken care of before, obviously. Like how much time do you suggest that we contact this insurance agent that you will contact us or hook us up with?
as soon as possible, I mean, really,
A couple of weeks. If you leave yourself a couple of weeks if you've got a real special need, just to make sure.
Yeah, because you gotta find out if you're insurable, right?
Yeah, and maybe we've got to look for the right product.
Right.
So for example, we've got right now in our group, we probably have access to 15 different what is that? We've got 8 different companies in Canada, and then we've got companies outside of Canada that we rely on and our own products. So we've got, if you wanted a Blue Cross, an Allianz, a Manulife, we can do that. And that's why they're slightly different, and we'll pick the right one to fit the need or the best one for that case.
Okay.
And that's a good point. There isn't a best travel insurance plan for everybody.
Will they give you like a car insurance quote? Can they give you 3 different products for you to choose from?
Yeah, absolutely. And cost may be only one of the factors that you're looking at. Another really important one might be how each of those will cover you specifically.
Okay. You're gonna hand out business cards after.
You have business cards?
Electronically, yes, I can.
I have a question, and I hope nobody in this room ever has to go through this, so now you've gone on your trip, unfortunately, you got ill. You come back to Canada like we have, and we're getting all these claims a year and a half later. When does it stop? When do they say it's too late, statutory requirement?
That's good. That's really good because this is the type of thing we back in 89 to 91, we created snowbird insurance in Canada because the province's cost shifted, right? So we worked with the ministries of health. And one of the biggest things to explain to Canadians is exactly what you mentioned before and you're mentioning now, is that if you go into a US hospital, they may have a separate billing building with 300 people in it or more. In Canada, a hospital like this may have 25. It's a big hospital. They don't have that many people because they've got one big payer. They've got one system they're working with. It covers OHIP will cover 95% of the bills. So if you look at that, and what they'll do is everybody charges separately because it's almost like a boutiquing out. The anesthesiologist is going to charge something. I remember this is back in 91 when the Ontario changed. We had a big chart that Newsweek magazine did of a person having surgery. We had the guy on the gurney, and then you had the doctors, you had everybody around, including a priest that was there, and they had a price tag under everything. The priest came to visit, and the priest charged $5 US for the visit. So and we had to explain that to Canadians because you're sitting in a hospital, you may get upset because you're not getting treated right away, or the medication they screwed up on. I've had that. No. So, little things will happen, but you don't have this big bill at the end, right? It's not a big thing, but in the US, you can sit there and all these things will come. And you've got to look also in other countries, like Mexico is a good example. There are really good healthcare facilities in Mexico, but there's also ones that are subpar, depending on where you are. So when we talked before about being prepared, understand where you're going and what the medical facilities are. St. Martin, for example, the Caribbean, and part of my life, I grew up in Jamaica, so I understand the Caribbean really well. So Caribbean, they've got really good medical facilities, but they only go so far. If you're going to have treatment for something more complex, you're going to go to the US, and some of them even come to Eastern Canada or to Toronto. So just think about that. So know what kind of treatment, what will happen if you're there, what you need to do, what the system's like. And these billing people, by the way, they're going to threaten you. We had to explain to Canadians too. They're going to threaten it. They're going to seize property. They're going to do everything if you don't pay the bill. They get really upset with you, this way they handle US clients. You can actually tell them to go stick it and give them the insurance company, if it's insurance company, or tell them to negotiate with you. Usually it should not affect your credit. I know that's scary, but
Well, I told them to go to the insurance company. Obviously, that's been working. They're great. Don't get me wrong. But I just wondering, when does it stop?
no, it's just because they will keep coming. And then what happens is the insurance company might be slow. After COVID, by the way, the travel insurance industry got decimated. I know my company, we actually had to pivot. We only lost about 10% of the business because we pivoted into other product lines, but we ended up paying for Alberta school boards because we handled all these student travels. We ended up paying about $5 million out in trip cancellation claims. At the beginning of COVID, it was 20 million. But we found out all these tour companies never actually paid anybody. And, so everybody was kind of cheating the system. So we got it down. But these companies went through a lot for that year and a half period. and they lost staff. They have problems now keeping up to things. So there's a lot of companies, we're finding that because I've come back into the business now in the Canadian market. And we're finding that people are having trouble. They can't get a claim paid, or things are taking longer and the systems aren't working well because they don't have enough staff in there.
You may even find that the travel insurance company that you used a number of years ago isn't offering it anymore. The number that I remember that I thought was amazing was the Tokyo Olympic Games, the amount that was paid in premium. I'm not talking about the claim, I'm talking about how much was paid for the insurance in the event of cancellation of the games was something like 100 million pounds or something like that. And then it happened, you know, that's an incredible thing. And so you can imagine if
That was
that single event.
That was one of the reinsurance companies we dealt with.
Yeah.
Markel had that for
So-
that cancel.
I know we've been a little over an hour and a bit, so I'm gonna just fast forward to a couple of slides here. So make sure you guys know of these various slides. We will share the deck. I think that's okay, Robin, right?
And if Nancy or Eddie have your contact information, I can see the sizes down one page.
And
Send it to you with the links on it.
And I just wanted to get to this because I know people will probably want to visit the website afterwards to just get the information and
Travel medicine. We actually just got a new partner that we brought onto the website called Rock Doc. And I know it sounds funny, but they started out doing medical services for bands and rock groups. And now, and travel medicine for them. So now they've got a virtual travel medicine. And they will actually organize with your local pharmacy based on the type of inoculations and vaccines you need. So we actually put that on because a lot of people don't know where to go or what to do. So it's right on the website. You can link through it.
as we wrap up here, any other last minute questions for us? Yep.
I was thinking maybe other people, what is the I know there are many variables, but what is the range?
It's going to depend on age, and it's going to also depend on the duration of the travel. And the coverage may or may not cost actually more because of a stable pre-existing condition. It may simply be more limited in terms of what it can do for you, given the pre-existing condition. So again, it'll really depend. What you can obtain easily, quickly is given characteristics of where you're traveling, the amount of time, or age, you can get a quote.
It's not a huge, it doesn't have to be a huge cost. The shorter the trip, like if you're going for a couple of weeks, no big deal. If you're going for 6 months, it's gonna cost more. So, and you can get quotes on it. I can tell you that if you're going for a couple of weeks, even if you've got a pre-existing condition, as long as you met the stability clause within the insurance, it costs $150 Canadian.
And if you don't meet the stability clause?
Then you've gotta, then you've gotta check what else is out there.
Oh, okay.
Yeah, because that might just exclude you right away.
By the way, I don't think that a stable pre-existing condition affects whether you're better off with personal insurance or in some cases you can get an annual multi-trip plan. If you're traveling, you frequently come and go from the US, for
The
example.
only problem with that, and I'm glad you mentioned it, because they call them annual plans, so you can take as many trips as you want, but no more than the length of period that you pick. It's like 15 days or 30 days. The only problem with that is technically the policies say that if there is any change during the year, that will affect your policy. So if you going and getting treatment and medication changes and things like that, an annual plan may not be effective for you because, you know, it will be for the first trip and then the next trip, you're screwed up, right? So just be careful about it. But companies are changing. I got to tell you, You know, I go back to the eighties, we looked at the combination of diabetes and heart disease and creating a higher loss ratio for claims that are coming in. And then things started evening out and you started seeing, so people with diabetes aren't getting penalized the same way. And I worked with Canadian Diabetes on this, and you start looking at, companies start realizing people are able to handle themselves, maintain themselves longer. Same with heart disease. So heart disease is changing because of the medications, the treatments that everybody's doing. So the insurers gradually catch up. But one thing I joke about is insurance companies are risk adverse. They're in the risk business, they're gambling, but they're risk adverse. So they're always a little bit nervous about what to do, and they're very conservative. So it just takes them a while to catch up. So, and I am surprised every time I come to a meeting where I see people with organ transplants and they're thriving. You know, things change.
Yeah, and actually a nice, thinking about what you're saying, Robin, a nice point to make here. So I think someone and heard this earlier, the insurance companies are making decisions about insurability with criteria that are very different from the doctor. So when an insurance company comes back and says, we won't or will cover this, they're not making a prediction or statement about your health, not telling you necessarily something that a doctor should be telling you. They're simply, as Robin said, playing the odds. They're simply providing feedback based on statistics, on probabilities, but it doesn't necessarily say something. In conclusion, please travel. Look at your health and all of the planning around that as an extra dimension, important dimension to your trip plan and enjoy yourselves. I really appreciate this opportunity. It was a great opportunity. I'm always really happy to be able to do this sort of thing for Robin, because as you may not know, I actually, while substituting for Robin, met my wife. So that's the reason why I'm happy to do it every time.
Thank you. Hold on, John.
Thanks, Robert. Really appreciate you taking the time and the effort to put the slides together. Super informative. I hope everybody got some of their questions or all of their questions answered. If anybody is interested in getting further information about Robin's products and want to talk to them directly, email the HeartLinks at heartlinksgroup@yahoo.ca, and we will send you out the information that we can so that you can contact Robin. John, I'd like to give you a token of our appreciation. Inside is something from Dr. Ross, who is one of the heads of our department. Dr. Ross has been integral in medical research as well as helping all of us in the department. He is also widely into doing hugely adventurous traveling and climbing mountains. And she's encouraging people to get out and get fit. Along with her, they have taken a heart transplant deal with them on all of these expeditions. She's gone to the North Pole, she's been to Antarctica, she's been all over. And her motto is test your limits. That is her motto. She wants everybody to go out and test whatever limits that they have in life and to live life to the fullest. And inside is a token of our appreciation for you today. Thank you very much. Before we leave, if you are ever